This week we're talking about the baseball athlete, specifically the baseball pitcher. So there's two different categories for risk factors. There's extrinsic risk factors and intrinsic risk factors. Think of extrinsic as baseball innings pitched. If you're playing on multiple teams, going to showcases, how many months out of the year you're pitching, those are all extrinsic risk factors. Now, being a physical therapist, I look at intrinsic risk factors. So I'm thinking of different range of motion, passive range of motion, active range of motion. How is their stability and motor control? Motor control is just a fancy word for muscle coordination. And then strength. So looking at the kinetic chain here, the baseball athlete uses all different parts of the body to create power and force. So the cervical spine, how does that move? How is the mobility there? Same thing with the shoulder. So how does the arm move? How does the shoulder blade move? How does the mid back move, your thoracic spine? How is the rotation at the hip in terms of internal and external rotation? And there's different parts of the throwing mechanics and how the front foot pivots that is important to rotation. And then lastly, dynamic stability at the ankle. All these are super important for minimizing the risk of injury for a baseball athlete throughout the season.